Hello everyone, I wanted to give you just a 10-minute screencast at most on your scenarios for your SOAP. I think this might help calm some nerves and just hopefully help ground you a little bit as I walk you through this. So the objective of this assignment is to help prepare you for the fact that in less than 6 months, in fact in some cases 5 months, you'll be out treating patients. That's not that long from now, because we're almost into May. So 5 months, you with the best of situations, you'll all be out there treating patients this fall. So before you go out there, you need to prepare yourself before you jump in to treat any patient. And this is where that you're going to start using your decision making, where it's not a script I'm providing for your CAT, which can be frustrating because you're then more used to having more information. And and more information is not better, actually. Providing you more information actually can lead to more confusion. So that's why we kind of kept it to just a couple of scenarios that are fairly basic to really just help you think about both of these cases, and you're only doing one that you're assigned and help you think. So the red flags are, what are your red flags? Not the patient red flags, it's your red flags. What are you going to do and not do to safely treat this patient? You safely treat. We're not talking about gait belts because obviously this person is walking in a clinic or is ambulatory. That's not, and you should look at your actual skill checks, and that'll guide you what your red flags are. They're no different than last term in 132. They're no different. They're the exact same. And you need to look at those, what those are. I'm not going to give away the farm and tell you what to put on your sheets. You know your red flags. What prison information would you seek in the evaluation? I'm going to give you a couple of hints there. What about PT goals? You've heard myself and Christina constantly say, what are the goals? What is the PT assessment of this situation? What did the PT assess in the evaluation? And what is their prognosis? How long is it going to take for this person to get better? That's partly seen in the eval, but it's also in that assessment, the going back to PTA 100, the PT assessment of the situation and the PT projected prognosis of this patient, of how long this can take to get better. So that's really what you need to look at for the evaluation. Medical history, of course, but goals and how long is it going to take this? What's their prognosis? Will they get better in this such a time? And most PT evals, or many of them, say this is a great rehab candidate. They don't always say that, but generally they do. So what are your initial intake questions for the patient? This is the subjective. I'm not going to tell you any more on that one. Cultural, physical issues to be aware of. Okay, well, let's take a look at one of these cases. Again, look at perhaps there's some cultural influences here. Perhaps, right? I think you can look through there and see that there perhaps some social determinants of health related to other things too, right? So you can look through there and just see if there are any and list them, right? Treatment options are included. What treatment options are included in the PT plan of care? So we look at this one, right? We see goals, we see a plan of care, but we really don't see a ton of short-term goals here, do we? We just don't. It's patient goals. So that's, again, a question for you to answer. What are some expectations of testing outcomes? Or what data collection would you gather? You know this. You've been practicing this for the last 3 or 4 months. You know that. I'm not going to tell you what that is. You know it. How are you going to perform those tests? What patient positions? So you have a tape measure. Okay, we're not giving you an inclinometer or goniometer. You got a tape measure, and that's all you got. Okay? What are some expectations? This would be, what would you think you would see? Test and outcomes. Improvement, going backwards, generally improvement, but you answer that question. How might testing outcomes affect your treatment, pros of treatment? You think about that. I'm not going to give away the answer. There could be some good outcomes, and there could be some negative testing outcomes. What treatment options are you planning for the patient? Prioritize your options. You got this beautiful plan of care, and we're looking at scenario 2 here. It can be different from scenario 1. Here's some treatment options you have, and here's what the patient is reporting, right? You make the call. You get a plan of care to work with. What are your anticipated response to your treatment? What do you think? You've had a couple of treatments already in both courses, right? You've had actually in 3 courses. What's the anticipated treatment response to your treatment with what you plan to do? What are some negative possible responses? There might be a negative response, we don't know. But that's for you to make a call what could be a negative response. Why would you contact the PT? You know this information. You know this information. Or nursing in the appropriate scenario. Now this situation, this is a high school student. This is somebody who lives at home. He's not in the hospital, right? Scenario number 1, is this person in the hospital? Is there a nurse involved? In this case, no. There is no nurse involved. So you wouldn't be contacting nursing in any of these situations. But would you contact the PT? Yeah, if something went haywire, or there might be a reason, but you determine what those reasons are. You know these. Go back to PTA 100, okay, and 101, and 132, and 103. What non-information would communicate to PT? Some of the nice to know, but you don't have to know PT information, like you're saying, oh, just by the way, how might family be involved in the scenario? Okay, a hint, you're dealing with a 16-year-old here. I think you have something to think about. And then universal design, ergonomic workstations. I think you have enough information on both these scenarios to decide what that might be. And don't think exhausted, right? It could be just as basic as 1 or 2 things. Look at what their goals are and what they're doing and make that call. Not elaborate. And your responses are based on the short answer rubric. So the content criteria clearly addresses the questions, worth 10 points. And there you go. And it's also linked here. So here's a SOAP note. So this is where you get, I would suggest, now you can do whatever you want. There's not a scripted, you must do it this way. I deliberately did not do that. But you can take this information here and come up with a pretty good treatment note or SOAP note, right? Because you got this information, you got subjective, you got objective. You don't need to reinvent the wheel. If you choose to say, well, I'm just going to go ahead and take this information and retest them and say that he made improvement, he has more rotation now, or you know, perhaps this individual has declined. You can make that call. You can change this, but I would suggest that you just take this information, put into an objective, and you can ad-lib a little bit from this treatment plan of care and think, this guy, he should have some exercises. He should have some exercises. He's weak and limited range of motion from what we know with cervical rotation. That's pretty limited. See 3 centimeters when you practice, and we practice, you know, with Mark using a tape measure. That seems pretty limited, and it is, right? You also see some postural problems. Don't get caught up in the scapula unless you really want to take a chance there. And if you know what to do, great, but you have a forward head, you have kyphosis, and then you have some other things going on in the lower trunk. But here's some good things that you can address with exercise, right? So that would be your objective. And your assessment, how do they do with what you did? Again, you can create this assessment as long as it matches what the assessments you've been working with before. And we gave you a little cheat sheet here. You can come up with a really good assessment. And then your plan. What are you going to do next time? So that's it for now. And I look forward to your SOAP notes. Don't stress about it. Please don't spend hours doing this assignment. It shouldn't be an hours of assignment. And please work together. And we'll talk about it more tomorrow in Open Lab. Take care. Bye.